Hey guys, so I wanted to do a video on how I'm treating my stretch marks. So I went to several medical spas and nobody will do microneedling for me, which is like one of the most proven ways to treat stretch marks, and it's really good to get them microneedled like while they're fresh. They will not do it on me because I'm breastfeeding and there is a risk of infection because it is like micro wounds that you're creating in your skin. So because of that risk of infection, if there is an infection, then it can affect the breast milk while you're breastfeeding. If something happens and you're like healing and you have a cut or like a microneedle puncture, you are using nutrients and all these other things to heal, and it could take away from the breast milk. So my thing is, that could happen if I was like chopping vegetables and I like sliced my finger. So I'm gonna say that I don't care. I mean, I understand they legally can't perform anything on me. So I ordered a professional microneedler from one of the medical spas and just like ordered it to my house, so it's all sterile and there's no risk of like the needles like falling into your skin. Like if you get a cheap microneedler, they could like break off into your skin, and we don't want that. And then it said on the website to sanitize the area, right? We're trying to not risk infection, and then use a serum, like a vitamin C serum, put it all over, and then do the microneedling, and don't go over the same area more than 10 times. So that's what we're going to be doing, and I will update you every 2 weeks. So because it's not as deep of a microneedle as the ones at the spa, you can do it more frequently. I'm going to do it every 2 weeks to give it that time to heal, and then also if there's anything like that happens, then I'll just stop. So there. I know the risks. I can't encourage anybody to be doing this, but I also know that there are people that have gotten like Botox, fillers, whatever, while they're breastfeeding, and they were fine. So I'm going to take my chances, and I'm going to show you all the results, and we're going to do that journey together. Okay, so keep in mind how sensitive of a video this is. Please don't make me feel horrible about myself. This is the situation. This is what happens when you're a mom. So first thing I'm going to do is clean the area. I already showered and cleaned with a mild soap, and now I'm just taking some hydrogen peroxide 3% solution, and I am cleaning the area before we start. Make sure you wash your hands and sanitize your hands before you do this. So now that the area is sanitized and dry, I'm just going to put on the serum. So I'm using this vitamin C anti-aging serum, and it's important that it's 20%. The hyaluronic acid in this as well helps with stretch marks. You can also do like a vitamin E serum if you want. Vitamin E and vitamin C are both good serums for stretch marks. Just use whichever serum that you prefer. This one I got, I think, on Amazon, and I got 3 of them for $80. So they're not cheap, but they are less expensive than professional microneedling, by far. Like the quotes I was getting for the whole area to be treated like with 3 sessions is a couple $1,000. So in the meantime, while I'm breastfeeding, let's just try and treat this on our own first. So this is the microneedler I purchased. Very fancy. It was about $150 plus tax. So again, cheaper than the microneedling treatments. If you get the Morpheus 8, it's 8 millimeters deep into your skin, and this is 3 millimeters, and they won't give you one deeper than that. On the box, they have the directions. Go horizontal first, vertical second, and then diagonal. And that's what it should look like by the end. Okay, so that's what we're doing. Okay, I was worried that this would hurt, but it definitely doesn't hurt at all. It's not going deep enough.
8 millimeters is pretty deep. That's almost a centimeter long. 3 millimeters is not so severe. It says with mild pressure, so I'm not putting too much. I'm hoping I'm doing this correctly. I almost didn't think the needles were in this thing, I'll be honest. Like, it's so tiny, but they're there. They're definitely there. Okay, now we're doing diagonal this way. Now I will be treating the other areas like my boobs, my hips, my thighs, whatever, but I'll just be doing updates on the stomach since it has the most concentrated amount of stretch marks. Some women are lucky they don't get stretch marks, and trust me, I was putting on lotion multiple times a day because I know my mom was prone to stretch marks, but some people just aren't as lucky. Okay, so like I said, this is what it looks like now, and we will update you in 2 weeks. When you're done with this, you need to soak it in a sterile solution of some sort, so I'm using hydrogen peroxide. I'm like so close to monetization, it's crazy. All I need is those subscribers, so please, 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 if you found this helpful or in any way, shape, or form, or if you just want to see the results, please subscribe. It would mean like the world to me.